Hello everyone. I welcome you all to the another interesting OYG session. This is Dixak Bhatt from Team OYG, and I welcome you all on behalf of our team. Today we have a wonderful speaker on the topic of OCD, and she is from the Delhi. So Anshita Singh is here with us to guide us on the topic of OCD. Anshita is pursuing bachelor's degree on psychology from Delhi University. An infinite loop of a curiosity keeps her on her feet to seek more. Anshita has worked as an intern in the Fortis Hospital and currently working on the research paper. She has also interned in a personality development school and has created some applicable modules. Also a beginner in coding, a mental health advocate, and a research enthusiast. She believes in brewing skills. Hello, Anshita. I welcome you all. We welcome you all in this OYG session, and I hope I haven't missed anything. So now, without further ado, I would like you to take over the stage.
Thank you. Thank you for the introduction. And I'm really glad to be here again. I did another session on mirror neurons and it was really interesting. And I'm so glad that I'm getting another chance to do it this year.
All right. So now you can just take over whatever you have prepared for us, and we are just excited to listen to you.
Sure. Thank you. Okay, so obsessive compulsive disorder. This is the topic that we're going to cover right now. And could you go on the next slide? So to give an overview, obsessive compulsive disorder, OCD, features a pattern of unwanted thoughts and fears, obsessions that lead to repetitive behaviors, which are compulsions. These obsessions and compulsions interfere with daily activities and cause significant distress. So unwanted thoughts are obsessions and repetitive behaviors are compulsions. So the terms used in OCD, obsessive, refers to the thought and compulsive refers to the behavior. You may try to ignore or stop your obsessions, but that only increases your distress and anxiety. Ultimately, you feel driven to perform compulsive acts to try to ease your stress. Despite efforts to ignore or get rid of bothersome thoughts or urges, they keep coming back. This leads to more ritualistic behavior, the vicious cycle of OCD. So, OCD is a vicious cycle of these repetitive thoughts and repetitive behaviors that causes anxiety and depression. And OCDs always have a theme, which we will cover later. OCD often centers around certain themes mentioned here. For example, an excessive fear of getting contaminated by germs. And we have seen a rise in OCD in these pandemic times because there has been constant alarming reminders about washing hands, using sanitizers. So these are the themes that OCD revolve around. To ease your contamination fears, you may compulsively wash your hands until they are sore and chapped. If you have OCD, you may be ashamed and embarrassed about the condition, but treatment can be effective. Next slide, please. Symptoms of OCD. How can you recognize that you have OCD or anybody that you know has OCD? Obsessive compulsive disorder usually includes both obsessions and compulsions. As we mentioned earlier, obsessions refer to the thought and the repetitive thought of doing something, and compulsion refers to the behavior that is a resultant of the thought. But it's also possible to have only obsession symptoms or only compulsion symptoms. This is one concept that is really important in OCD, is that they don't necessarily have to occur together. Some people just have obsessive thoughts, or else some people just have compulsive behaviors. So these can occur together or independently. You may or may not realize that your obsessions and compulsions are excessive or unreasonable, but they take up a great deal of time and interfere with your daily routine and social work, social, school, or work functioning. Next slide. Obsession symptoms. So obsession, as we mentioned, is the thought aspect of OCD. OCD obsessions are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You might try to ignore them or get rid of them by performing a compulsive behavior or ritual. These obsessions typically intrude when they are trying to think of or do other things. When you're trying to take your mind off of the obsessive thought that leads to OCD, that is the time when you actually start thinking more about what you want to do or that particular urge. As mentioned earlier, OCD generally revolve around a particular theme. So, for example, you're working, you're studying, taking a class online, and then suddenly your OCD, your obsessive thought kicks in about how germs could affect your health, and then suddenly you have this urge to wash your hands again. And this could happen on a loop. This could happen every 2 minutes, every 5 minutes, every hour, depends on how extreme the condition is. Next slide, please. Obsessions often have themes to them, such as fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming yourself or others, unwanted thoughts, including aggression or sexual or religious subjects. So we discussed about themes, which is the theme which is related to fear of contamination or dirt, and I also mentioned earlier that this theme for OCD particularly has increased during this time of pandemic because of the COVID situation. The next theme is doubting and having difficulty tolerating uncertainty. So the anxiousness about how the future might turn out or how uncertain your situation is currently could also lead to ritualistic behavior. For example, overindulging in worshipping or overindulging in certain acts which are mostly just your thoughts or mostly just rituals that you think would help you control that anxiety. Needing things orderly and symmetrical. This is a very common example shown in TV series also, in TV shows also, that a person who wants things organized, like pens organized in a particular color, or there are times when people have to set their microwave to like 30 seconds only or 1 minute only, or probably just have a particular amount or a particular number of things on their desks, or they have to be very or there's this fear of odd numbers. So these are certain orderly and symmetrical needs of people, which ultimately leads to excessive thoughts and OCD. But it is important to note that until and unless these thoughts are intruding and affecting your daily life, they aren't really as severe as OCD or as severe as to be called a disorder. Next theme is aggressive or horrific thoughts about losing control and harming yourself or others. So these thoughts could be very violent, aggressive. The theme is pretty clear on its in itself, that this type of theme in OCD could often lead to aggressive or horrific thoughts about just going out and killing people on a spree, or hurting somebody, or harming your own self. The last theme mentioned here is unwanted thoughts, including aggression, sexual, or religious subjects. So these thoughts could be certain thoughts that is just stick in your head that you don't really want, and they're giving you distress and anxiety. Could you switch to the next slide, please? Examples of obsession signs and symptoms include fear of being contaminated by touching objects others have touched, doubts that you have locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of situations that can trigger obsessions such as shaking hands. One of the common cases of OCD that we get is people washing hands again and again, people going to check their doors again and again, or checking the switches and the stove again and again. Uh, Another case could be that a very disturbing picture, you see a very disturbing picture, and it sticks with you somehow. It is very distressing and it is very anxiety provoking, yet that image is stuck in your head, and it has gone so bad, like uh, the thought of that image is so stuck with you that you're not able to perform your daily tasks, and you're not even able to carry out your daily life. So these are a few examples of few cases of OCD. Next slide, please. Compulsion symptoms. Compulsion symptoms are the behavioral aspect of OCD. OCD compulsions are repetitive behaviors that you feel driven to perform. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in the compulsions brings no pleasure and may offer only a temporary relief from anxiety. You may make up rules or rituals to follow that help control your anxiety when you are having obsessive thoughts. These compulsions are excessive and often are not realistically related to the problem they are intended to fix. So, compulsive behaviors are basically the repetitive behaviors that are a resultant of the obsessive thoughts. If you're constantly thinking about washing your hands because of germs and um, other microscopic organisms, then you would have this urge to keep washing your hands. And the cases go so extreme that people often have chapped hands and their skin peel off and they start bleeding even at times. So this is how extreme these compulsive behaviors and these compulsive symptoms could be. Next slide, please. As with obsessions, compulsions typically have themes too. These are, as such, washing and cleaning, checking, counting, orderliness, following a strict routine, demanding reassurance. So, these are the kinds of compulsive behaviors that can occur due to OCD, such as washing and cleaning. So, when we think about these germs, when a person who's suffering with OCD has a tendency to constantly think about germs and microorganisms, they would have the tendency to keep washing their hands too. So, that is the behavioral aspect, and that is how the compulsion part of OCD kicks in. Checking, counting. Checking could be going back to check your stuff and going back to check the switch if you have turned it off or not, checking the locks if you actually logged it or not. Then counting, counting religiously. It often happens that people suffering with OCD would count the number of steps that they take in a day, or and like for example, if they are distracted while walking and they miss a step, they miss counting a step, so they would go back to where they started and then start counting again, because that is how compulsive that behavior is for them. Then orderliness, following a strict routine, uh, just going here a minute or two here and there as per their routine could cause them a lot of distress and anxiety. Next slide, please. Examples of compulsion signs and symptoms include hand washing until your skin becomes raw, checking doors repeatedly to make sure they're locked, checking the stove repeatedly to make sure it's off, counting in certain patterns, silently repeating a prayer or a word or a phrase, arranging your canned goods to face the same way. So, these are a few examples of compulsive behaviors which we discussed. Next slide. So there are a few important points to note that the first point is the severity varies. So OCD usually begins in the teen or young adult years, but it can start in childhood also. Symptoms usually begin gradually and tend to vary in severity throughout life. It doesn't have to be that a 5-year-old or a 8-year-old kid has OCD, but there might be symptoms, and it might not be a very extreme form of OCD, but that might be a start to a very severe condition. The types of obsessions and compulsions you experience can also change over time. So it is not necessary that a person who's suffering from OCD has a tendency to keep washing their hands. Doesn't mean that their tendencies could change. They could probably then start being obsessed about checking their locks. So the conditions or the themes can also vary over the period of time the person is suffering from OCD. Symptoms generally worsen when you experience greater stress. So the more the stressed the person is, the more the anxious the person is, it is a greater chance for that person to have OCD like symptoms, or have the tendencies or the urges to kick back in while the person is stressed. So OCD usually considered to be a lifelong disorder. It can have mild to moderate symptoms, or be so severe and time consuming that it becomes disabling. So extreme cases of OCD are such that people often get late, and they don't even go reach to the places that they need to, because they were so preoccupied with washing their hands or checking the locks. They would check the lock once, go downstairs, and they would again want to check the locks, because they're so uncertain, and they have this obsessive thoughts going on in their head, and the compulsion to keep checking the locks or to keep washing their hands, that it becomes so disabling that the person is not even able to carry out the daily tasks. It is very sad that there's a stigma attached, that people often say that it's okay, मतलब छोड़ दो, तुम सोच ही रहे हो, ऐसा नहीं हो सकता, like just get over it, and this is very idiotic to just keep thinking about the same thing. But it's just that the person is stuck around those particular thoughts, and those thoughts are so obsessive and so compulsive that they're just not able to get over it. The second point is when to see a doctor. This is a very interesting point, because a lot of people have OCD tendencies which are not as extreme. Like, for example, even I have a tendency to have all my books stacked in a particular order, or have my desk in a particular order, but that does not mean that I have OCD. It is just that I have a tendency to stay organized no matter what. So this is where people need to understand that where does that line exist? When does a, a tendency becomes into an extreme behavior, and when does it become a disorder? So there's a difference between being a perfectionist, someone who requires flawless results or performance, for example, and having OCD. OCD thoughts aren't simply excessive worries about real problems in your life, or liking to have things clean or arranged in a specific way. If your obsessions and compulsions are affecting your quality of life, see your doctor or mental health professional. If your tendency is to have something in a particular order, or to do something in a particular way, is just because you're wanting to have those things, or if you're only wanting to be organized, then it's just all right. But when those behaviors start to affect your daily life, start to affect your work, that you're not able to reach on time, or you're not able to think about anything else but being organized, or but washing your hands, then you need to see a doctor, or a mental health professional. So this is really important to understand when the severity becomes extensive and so elaborate that you really need to go see a doctor. Next slide, please. So the causes of OCD. The causes of obsessive compulsive disorder isn't fully understood. So there are a lot of perspectives in psychology that suggest different causes. It could, the psychoanalysis perspective suggests that there's something in the childhood that goes wrong, that a person is regressed, and their thought gets stuck on those particular things. And there are behavioral perspectives wherein they say that it's because that particular behavior has been reinforced such that that behavior has set into that person. But here we are covering 3 points, the 3 main theories, which is biological causes. OCD may be a result of changes in your body's own natural chemistry or brain functions. It is interesting to know that a person who is suffering from OCD has a different brain structure. In fact, for most of the psychological disorders, the same applies, but people don't really understand that psychological disorders are also at times physically disabling, and at times do have a physical proof that a person is suffering from a psychological disorder. So the brain structure of a person suffering from OCD often changes, and results in the vicious cycle of OCD. Then the other point is genetics. OCD may have a genetic component, but specific genes have yet to be identified. Although there is proof that OCD can be a genetic disorder, but we haven't been able to recognize the exact gene that contributes to OCD. Learning obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. So one of the most common example for learning could be this pandemic situation, that there are a lot of advertisements, there are a lot of awareness programs, and a lot of articles and magazines and research that tells you to keep sanitizing your hand or keep washing your hands with alcohol based liquids or whatever. So these things could eventually reinforce the person to keep washing their hands, and the person who takes this suggestions very ritualistically could ultimately lead to suffer from OCD. Mm, Yeah, so these three are the main causes for OCD: biology, genetics, and learning. Next slide, please. Risk factors. So there's this concept in psychology and psychological disorders that um, a lot of people are often prone to certain disorders. So those are the risk factors attached to that particular disorder. So factors that may increase the risk of developing or triggering obsessive compulsive disorder include family history. Having parents or other family members with the disorder can increase your risk of developing OCD. So this is pretty understandable. Even with cancer or having twin babies, these are also often genetic and are caused because of family history. Uh, the other aspect could be stressful life events. If you have experienced traumatic or stressful events, your risk may increase. This reaction may, for some reason, trigger the intrusive thoughts, rituals, and emotional distress characteristic of OCD. So another example related to COVID situation could be that, for example, one of your relative, God forbid, dies by COVID-19. So you suddenly have this realization that this could happen to you too, or any theme revolving around it, and then you just have this urge to keep washing your hands to stay away from COVID-19, or the just or catching the COVID. So it's just that certain stressful life events could eventually lead to creating ritualistic behaviors and can often lead to OCD. Other mental health disorders. OCD may be related to other mental health disorders such as anxiety disorders, depression, substance abuse, or TIC disorders. So uh, other it's very common in psychology and counseling and clinical psychology to have cases where one disorder is accompanied by a few more disorders. So anxiety disorders, depression, the depressive disorders, these disorders could eventually lead to OCD. So these are the main factors that would contribute in the development of OCD. Next slide. Complications. Problems resulting from OCD may include, among others, there are always other complications that may arise from OCD: excessive time spent engaging in ritualistic behaviors, health issues such as contact dermatitis for frequent hand washing, difficulty attending work, school, or social activities, troubled relationships, overall poor quality of life, suicidal thoughts and behavior. So these are certain complications that could arise due to excessive OCD. Next slide. Prevention. So this is sort of a very important aspect because there's not really a sure way to prevent OCD. However, getting treatment as soon as possible may help prevent OCD from worsening and disrupting activities in your daily routine. Next. Thank you. I suppose I've covered most of the aspects of OCD, the causes, the factors that affect OCD, preventive methods, and the symptoms of OCD. And if there are any questions, then you could always mention the comments and I could reach out to that. Thank you.
Hi. It was a wonderful presentation, and we really enjoyed the presentation. So now I have just a few questions for you, so that if you could answer the questions, as I have just note down some points from your presentation.
Sure, sure.
Uh, as as the patient of OCD comes to a aspiring naturopath, just like us, we are the naturopathy. So if a patient comes to us, what are the things we should be taken care of
Uh,
if a patient approaches to us?
so, like as
Yeah,
friends and relatives, what we should take care of? Is that what you're asking?
yeah, that is what.
So, what we can do at most is listen to them, listen to what they're going through, because we're not practitioners, because we're not clinicians, we're not able enough to, suggest advice or give advice. Um, I think the most we can do is help them to seek help, as in to contact a clinician and get a professional help and a professional say in the situation.
All right. And another thing I wanted to learn that as you have behavior studies, right? You have studied the behavior of people. So I have noticed that when the people comes to us, they have diagnosed with a severe condition. So how to deal with those kind of behavior that patient is, right now it's not in a good condition of a mental, and we need to deal with that patient and give them a faith that no, naturopathy could work. So how to deal with those kind of behaviors? If you could guide us on that.
So you're asking that what if the person suffering from OCD is not open to help? Is that what you're asking?
Yeah, exactly.
Right. So if a person is not open to help, the most we could do is help them realize that how they actually need help, because their own personal life is being disrupted and their own personal daily routine is being disrupted. And in OCD, in most of the cases, the people actually know by themselves that they're going through something. In disorders like schizophrenia or depression, at times people don't really understand that they're not able to recognize that they're going through an illness, or they're
Yeah.
suffering from an illness. But in OCD specifically, most of the people recognize that, okay, this is what I'm going through, because the extreme cases of OCD people, uh, the disorder converts into a physical ailment, because you're washing
Yeah,
your hands a lot of times, your hand is all
right.
dried
I
out.
agree.
So I think to be able to help the person understand that you're really going through something is the most we can do.
Okay, so I want to know that what is your journey? How you get interest in this kind of a subject, psychology?
My journey in the subject psychology.
Yeah, exactly.
So the first time I got introduced to the subject was in class 11th, and so I had PCM, I had science in class 11th, and I just took psychology because it was an easy subject, and to have those three core subjects PCM, I just wanted to have something very easy on my plate. But then over time, when I read the subject, I realized that my interest lies in this area, and I just want to understand more, and I have this natural tendency to understand people, or to know people, and to understand where their behavior comes from. And then during that time, I also read about um, brain plasticity and neuroscience and
Uh,
biopsychology, and that sort of pushed me into taking psychology, because I was really intrigued and I was really fascinated. So yeah, and then I took BA in Delhi University, and now I'm in my second year.
Lucky you, you got your dream job.
Yeah, yeah. Uh,
Uh, can you share any experiences of yours with a patient of OCD?
um, Not really. I haven't been in contact with any of the OCD patients, but I can say one thing is that in a lot of TV shows and in a lot of movies and songs and whatever, there's a very casual mention of OCD. Like it has happened with me also, that people would just tell me that you're OCD because you want things in a certain way, but that
Yeah.
is not what OCD is, and it's very hard to propagate the idea that OCD is a very disrupting, is a very distressing, serious disorder, and people need to change the dialogue behind it, because it has become so casual to just say you've OCD, you have OCD. So I think that dialogue needs to be changed, because people who are actually suffering from OCD, they're going through a rough time. They are going through an illness which is literally has trapped their heads because they cannot think anything else other than
Then
what
the
they're
obsession, yeah.
yeah, than the obsession or the compulsion. So I think it is really important that we change the dialogue behind OCD.
No, you explained it very well in your presentation that how it OCD is different from the normalization. So it is
Right.
particularly good. Last question from my side. Uh,
Yeah.
what are your experiences with naturopathy? How is naturopathy helpful to you? That's what I wanted to ask.
Um, I mean, I've heard my mom say this a lot of times that you should always prefer nature over chemicals or, whatever.
Yeah.
So I think in that way, I mean, I don't have a lot of idea about naturopathy, so I just leave this here only.
All right. Thank you so much for joining with us. And we would like you to join again with us if we had a chance on this virtual platform or maybe on the not virtual and offline if everything gets settled down. So we would love to hear you again. And thank you so much. So
Definitely. Thank you. Thank you for having
thank
me.
you for giving us your time and this wonderful knowledge.
No problem.